So welcome to our weekly update. It's the first day of March, and this month marks a full year of our COVID-19 updates. Thank you for staying tuned with us and staying informed. Honored today to have Decatur Morgan Hospital President Kelly Powers back with us. Kelly, thank you so much for joining us.
Thank you.
Yes. And then, of course, Alabama Department of Public Health, we have Michael Glenn back with us. Michael, thank you for joining us again today. Appreciate the updates that you provide. Just a little bit about the numbers. Don't want to get your head spinning with a lot of numbers, but today we have 11,479 confirmed cases and another 2,188 probable cases. So that brings us to 13,667 cases. Our 14-day percent positive rate has fallen again to 9.87%. I say that in seeing the dashboard come up every day this week, less yesterday, I continue to smile at what I'm seeing, but I know that it's just so important that while we can see light at the end of the tunnel, and of course we have the good news regarding Johnson & Johnson and what they're going to try to roll out in the coming days, we've got to continue doing what we've been doing all along and never let up. And I think last week the phrase was keep our foot on the gas.
Right.
And so we want to continue to do that. So Kelly, if you will, why don't you give us an update from the hospital?
Okay. Thank you, Mayor. We currently have 16 inpatients, and I think it's kind of up and down. So I think we'll continue to see that. I think we were down to 9 at one point. You know, we're at 16. We've got 4 in ICU, 2 on the vent, 3 probable or PUIs, and then 1 of those is in ICU. So one of the things I want to share today is that we're still continuing to see people waiting late to come in. So if you've had COVID or currently have COVID, the sooner you come to the hospital and get care, the better your outcome's going to be. Again, we're continuing to see people who get to the point where their oxygen level is really low, and by the time they come to the emergency room, they're on the ventilator, and then things aren't good from there. So I just want to stress to all of our citizens that, you know, if you're feeling bad, come on in and let us just check you out and make sure that we get you some medicine as soon as possible so that you don't end up on the ventilator.
You know, whenever I was, right before I tested positive, I had what felt like just the basic crud.
Yes.
And, you know, congestion in my chest and that type of thing, and sought medical attention for that. And it was through that effort that my physician said, look, we're going to treat you for your symptoms, but we need you to go get tested. That's our protocol. And so that led to what you're describing now. So if you feel like you have the crud or just symptoms of that nature, please go ahead and seek help. And then we trust that whoever medical professional that you seek that help from, that they will end up asking you to take the test, determine if you're positive or not. Michael?
Well, thank you for allowing us to come and give an update again. The numbers do continue to tread in a positive direction, and we're thankful for that. As you already alluded to, our positivity rate over the last 14 days is less than 10%, which is manageable. That's great. It's heading in the right direction. The state rate is hovering around 8%, so that's great as well as statewide, and so we're thankful for that. To build on Kelly's report as well, with the hospitalization rate statewide is at 657 as of yesterday, and that's the lowest people hospitalized statewide since June the 28th, and so that's wonderful. It's a manageable number right now for our hospitals statewide, and so we need to keep doing what we're doing. The health department is back doing first dose of vaccinations again, so that's a wonderful thing to get more vaccine into arms. Our online scheduling system went live for the health department at the end of last week, and so alcovidvaccine.gov, that's alcovidvaccine.gov, to schedule your first appointment. A very quick and easy process to go through. When you go to that website, it says to schedule a vaccine, put in first dose, and then it asks you what county you're looking for, and then your category that you fall into, and then you put a name phone number and email address, and you get a text message if you want to, an email confirmation to confirm your date and time. And so we would encourage everybody that wants the first dose to go on the website alcovidvaccine.gov and schedule your vaccines that way. The health department will be doing that on appointment only. To kind of help the flow of the clinics a little bit more, the morning appointment are for appointments. And so your appointments will be confirmed for the morning. If you're scheduled for a second dose, to not only help you not have to sit in line, but also the health department staff as well. If you will come in the afternoon, your second dose is available. So everybody that's time for a second dose that you got your vaccine at the health department, your vaccine is there and we will get it to you. So if you will come in the afternoons, that'll make the flow a little bit better. Some good news over the weekend, as the mayor alluded to, that Johnson & Johnson had gotten emergency use authorization for their vaccine. So that's wonderful that we've got another vaccine available to get into arms. The only downside really to that is the number of those that are due. It's around a little less than 4 million doses that are due right now that they'll be getting out this week. They have promised to get about 20 million doses out by the end of the month, so that's a great number as well. I also saw an article this morning that Pfizer and Moderna said that they would be able to produce 220 million doses by the end of March. And so all of those doses coming available is going to help the markets get saturated a little bit more so that people that want a vaccine can get a vaccine. And so that'll be our report unless we have questions.
Good. So curious now, for those that may not have access to the internet,
Right.
is there a phone number that they can use?
Well, we would encourage someone that doesn't have internet access maybe to reach out to somebody in their church family or to a family member to help them to register online. But if you don't have any contacts, you don't have any way of doing that, if you'll call your local health department, we will try to assist you into doing that. But again, for the people that are answering the phones, if we're bogging the phone system down, it's not as many people to help get the vaccinations out. So if at all possible, get a church member, a family member, somebody that you're close to that has internet access to go on and do that for you, because it's a very quick process. And if all else fails and you need somebody, then call your local health department and we will try to assist you the best we can.
Okay, so we mentioned about a month ago that the city had been working with our faith-based community.
Yes, sir.
And trying to organize something just like what you're talking about. So it sounds like it's time for us to move forward with that.
And we, some of our staff members have, over the weekend, have helped people to register online as well. It is a very quick process to do it on your phone. Any kind of internet access that you do, it's just a couple of minutes and you can get your confirmation real quickly. Okay,
now remind me where we are as far as those that are eligible for the vaccine. Kelly, can you?
Well, and Michael may know more, but, 65 and older.
Yes.
Essential workers, teachers, there's a whole category out there, even some manufacturing that's included at that level. So,
yeah. It's 65 and older, all healthcare providers, first responders, and those that are in the food processing thing, sort of like if to get food to the grocery stores. And so those people are in those eligible categories right now. I really have grown to detest the word essential because every industry is essential. Just to kind of something funny, for those that are close to me know that I love a certain drink, and if that drink is not around, that bottling company is not available, I'm going to be hard to deal with. And so that bottling company is very essential people, but they're just not in the priority groups at this point in time. And so the priority groups are those that we 65 and older, because they are the ones that are having the worst outcomes if they get COVID positive. And so we're trying to take care of those folks first. First responders and the healthcare folks, because they are the ones, like Kelly's staff, are taking care of them once they get to the hospitals. And then our food folks, because we need stuff at the grocery stores when we go. And so those are our priority groups. Everyone is essential, and we're going to get vaccine in the arms as quickly as possible to get everybody covered. And it sounds like if the articles that I read this morning with Pfizer and Moderna getting 220 million additional doses out by the end of the month, and Johnson & Johnson getting 20 million, we're headed in the right direction as far as getting the market saturated so we can open up to get other priority groups taken care of.
And then we have so the governor's current order is effective through the 5th, which
Yes,
is
sir.
Friday.
Yes, sir.
She's been good, Governor Ivy, she is her name. She has been very good about getting out in front of that. She and Dr. Harris, so anticipate something coming out
Yes.
just any day regarding the,
Anticipate at least by Thursday or Friday having another conference for the update on that.
okay, thank you. All right, well, Madison with WAFF is with us. Any questions, Madison?
Yeah, I guess really the only one I can think of right now, just a quick update in terms of what vaccines are kind of being the most consistently shipped right now. I know that you said a couple weeks ago that Pfizer was being a little bit more consistent with shipping, at least to
Yes.
the hospital, than Moderna. We said that when it comes to Johnson & Johnson, kind of nothing set in stone yet, but expect later this week. So I kind of wanted to get an update of what the deal is with the vaccines at the hospital and the health department.
And we worked on a schedule, so I hope from now on to have a little more detailed data on our vaccines. We currently have right at 8,000 people in our queue to give a vaccine to. We have 4,697 doses available. And those are first doses. Keep in mind, we're saving all of our second doses. So when you come in and get your first dose, we go ahead and make your appointment for your second dose. So we have those saved for you. But again, we are doing really well with Pfizer, and we should get enough, I think, weekly allotted to us to keep us going. So it's really good. And I just encourage people, as Michael said, we have our website out there. So go to Decatur Morgan Hospital .net.org and sign up on the form, and we'll get you in the queue to get registered.
Awesome.
Same with the health department. If you schedule your first dose, that second dose is being held so that you are scheduled that day when you get your first dose for your comeback in 4 weeks. And so you don't have to worry about, I've got to get there, somebody's going to get my dose. And so the flow of Moderna for the health department at this point in time has been steady. And so we don't anticipate, hopefully the supply chain stays available so that we can continue with what we have right now. But we're doing well right now.
Good.
Okay, very good. And then we have a phone call from Laura Harkson with WHNT Channel 19. Lauren?
Hey, Lauren, are you there?
Yeah, hey, I'm here.
Please proceed with your questions.
Okay, perfect. Good morning, everyone. Hope your day is going well so far. So I know we are all excited about the Johnson & Johnson vaccine being approved. Do we have any idea when we might expect some of those vaccines to come into Morgan County or Alabama itself?
No, the allocation for the Johnson & Johnson has not been, we've not been given that information yet. All of those doses are supposed to be delivered from the information that I have first of this week, so around Tuesday or Wednesday of this week, and so those will be made available a little bit later in the week that I'll know of.
Okay, perfect. Thank you. And then also, I guess we're also wondering how many more people would need to get their shot in the 1B plan before moving on to the next one, 1C, and maybe how soon y'all think that might be.
Well, I don't have a crystal ball to be able to predict that. It's right now the demand is still very high. Until we get enough people in 1A and 1B vaccinated to open up to another group would just cause more frustration, I believe, at this point in time, because we are saturated with those that are still in the priority groups that we're targeting at this point in time.
Okay, so that might be kind of far-ish away. Do you know if that progression will be a state call or by county?
Yes, it will be a state call.
Okay, perfect. Thank y'all so much.
Thank you, Lauren.
So it's hard to believe that COVID and all that goes with it has been with us for a year now. We're encouraged to know that the vaccines are rolling out at a faster pace, and we're thrilled to know, as we've mentioned today, that Johnson & Johnson's one-dose vaccine has now been approved for distribution. I know that we are all weary of this protocol, but please continue to take the steps necessary to ensure that you, your loved ones, and your neighbors are safe and healthy. And most of all, let's continue to be kind. Our next press conference will be Monday, March the 8th at 10 a.m. and we look forward to seeing you then. Thank you.